Do you know the difference between turf toe and gout? It can be confusing since both conditions affect your great toe joint, but there are distinct differences between them. Turf toe and gout have different causes, symptoms, treatments, and long-term prognoses. So what's the difference? I'm Houston Podiatrist Dr. Andrew Schneider. In today's video, we'll dive deep into these two conditions to help you understand their similarities and differences. Turf toe is a painful injury of the great toe joint caused by overstretching or hyperextension of the ligaments of the big toe joint. On the other hand, gout is a type of arthritis that occurs when too much uric acid builds up in the bloodstream and forms needle-like crystals in a joint. The most common place for these crystals to form is the great toe joint. However, they can also form in joints throughout the body. In order to help you better understand turf toe and gout, we'll discuss their causes, symptoms, treatments, and long-term prognoses. But before I move on, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. Turf toe is a sports-related injury to the big toe joint. It's caused by excessive stretching of the ligaments that connect the bones of the foot to the big toe. This condition can also occur due to a direct blow or sudden force applied to the joint, like when pushing off from a jump. The primary cause of turf toe is an excessive force placed on the big toe when it gets pushed beyond its normal range of motion. This can happen when an athlete stops abruptly or changes direction quickly while running. The force can also be caused by a direct blow to the foot or by landing on the toes after jumping. Even tight-fitting shoes can play a role. If they don't offer enough flexibility for movement, they might restrict the range of motion for the toes. The main symptom of turf toe is pain in the upper part of the big toe joint, which can become quite severe with activity. Swelling and tenderness around the joint may also occur. The name turf toe comes from its prevalence among athletes who play on artificial turf, as it's more likely for such surfaces to cause extra stress on toes and feet than natural grass. It's most commonly seen in football players and other athletes who are involved in activities that involve quick starts, stops, and lateral movements. However, anyone can experience turf toe regardless of their sport or surface type. Turf toe usually responds well to rest, ice, compression, and elevation, known by the acronym RICE, as well as over-the-counter anti-inflammatory medication such as ibuprofen. The athlete should avoid activities that put stress on the affected areas while they heal. In more serious cases, medications such as anti-inflammatory drugs may be prescribed to help manage pain and inflammation. Physical therapy is also a key component to the treatment for turf toe. Exercises designed to increase strength and flexibility can help improve joint range of motion and stability, reducing the risk of further injury. Additionally, custom orthotics may be recommended for added support during recovery from turf toe injuries. Individuals who are dealing with turf toe should take steps to limit any further damage to their joints by wearing supportive shoes that provide cushioning around the toes and avoid activities that put too much strain on them. With proper care and prevention methods in place, individuals should be able to recover fully within a few weeks or months, depending on the severity. Gout is an inflammatory condition caused by uric acid buildup in the body. Uric acid is produced from the breakdown of purines, which are found in certain foods and drinks. High level of uric acids can cause crystals to form around the joints, leading to inflammation, pain, and swelling. On the other hand, turf toe is an injury caused by repetitive stress on the big toe joint due to sports or other activities. Diagnosis of gout is usually done through physical examination and a review of the patient's medical history. I'll look for signs such as a swollen, red, or tender joints, joint pain that increases with movement, and stiffness in the joint. I may also order blood tests to see if there are elevated levels of uric acid in the blood. When it comes to causes of gout, diet plays a major role. Foods high in purines such as red meat, organ meats, seafood, and beer can increase levels of uric acid in the body and trigger gout episodes. Other lifestyle factors that may contribute to gout include obesity, excessive alcohol consumption, dehydration, high blood pressure, or certain medications like diuretics or niacin. In addition to dietary factors and lifestyle changes that can help prevent gout attacks, there are also medications available to help manage symptoms and reduce inflammation. Non-steroidal anti-inflammatory medications may be prescribed for short-term pain relief, while colchicine or corticosteroids may be used for more long-term treatment. Other treatments may include lifestyle modifications such as weight loss and limiting alcohol intake. Treatment for gout depends on how severe the symptoms are and how long they've been present. NSAIDs are often used to reduce inflammation and pain, while corticosteroids may be prescribed for more severe cases. Dietary modifications can also help to reduce the chances of future gout attacks by limiting the intake of foods that are high in purines such as organ meats and seafoods. In addition, drinking plenty of fluids, especially water, can help flush out uric acid from the body, while taking medications to lower uric acid levels that can also be beneficial in preventing future gout attacks. It's important to talk to your doctor about any questions or concerns you have regarding diagnosis or treatment options for gout. It's important to note that gout is a chronic medical condition that requires careful management over time, since episodes can recur without proper treatment. Therefore, it's important for those with gout to follow their doctor's instructions carefully and make any necessary lifestyle modifications in order to reduce the risk of experiencing further episodes of gout flare-ups. Continuing to have acute gout attacks can significantly impact the great toe joint. The uric acid crystals can erode the bone and they can form gouty tophi, which are cysts filled with uric acid crystals. In some cases, these need to be drained surgically. Turf toe and gout are two conditions that cause significant pain and discomfort in the great toe joint. Taking part in high-impact activities such as running or jumping can increase the risk of developing either condition, so it's important to be aware of its symptoms. While lifestyle changes such as eating a balanced diet and exercising regularly can help reduce inflammation, additional tests might be necessary to confirm a diagnosis. Lastly, over-the-counter medications and supplements can help with pain relief, but long-term effects from either condition should not be ignored. If you're experiencing any persistent symptoms related to turf toe or gout, it's important to consult your podiatrist for proper treatment. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. Think you have turf toe or gout? Or are you unsure which you're dealing with? Come into the office for an evaluation so I can help you to determine the cause of your pain. No more suffering. The link is in the description. Thanks so much for watching and have a great day.